Clinical manifestation. In many cases, the sign and symptom of myocardial infarction cannot be distinguished from those of unstable angina. Chest pain that occurs suddenly and continues despite rest and medication is the primary representing symptoms. चेस्ट पेन अचानक होने वाला दर्द जो आराम करने या दवा लेने के बाद भी ठीक ना हो. Sometimes have prodromal symptoms or previous diagnosis of coronary artery disease, but about half reports no previous symptoms. Patient may present with a combination of symptoms including chest pain, shortness of breath, indigestion, nausea, and anxiety. Patient may have cool, pale, and moist skin, heart rate, and respiratory rate may be faster than normal. Assessment and diagnostic method. Patient history, description of presenting symptoms, history of previous illness, family health history, particularly of heart disease, ECG, electrocardiography within 10 minutes of chest pain onset or arrival at the emergency department, echocardiography to evaluate ventricular function, cardiac enzyme and biomarker, creatinine kinase, isoenzymes, myoglobin, troponin, and medical management. The goal of medical management are to minimize myocardial damage, preserve myocardial function, and preventing complications such as the lethal dysarrhythmias, cardiogenic shock, perfusion by emergency, use of thrombolytic medication, or percutaneous coronary intervention (PCI). Reduce myocardial oxygen demand and increase oxygen supply with medication, oxygen administration, and bed rest. Coronary artery bypass or minimally invasive direct coronary artery bypass (MIDCAB). Pharmacological therapy includes nitrates, nitroglycerin to increase oxygen supply, anticoagulants, aspirin, heparin, analgesic morphine sulfate, angiotensin converting enzymes inhibitors, beta blocker initially, and a prescription to continue its use after hospital discharge. Thrombolytic alteplase, activase, and replase must be administered as early as possible after the onset of symptoms, generally within the 3 to 6 hours. Assessment patient with ACS. Assess the level of consciousness, evaluate the chest pain, most important findings. Assess the heart rate and rhythm. Dysarrhythmias may indicate not enough oxygen to the myocardium. Assess heart sound. S3 can be an early sign of impending left ventricular failure. Measure the BP to determine the pain and treatment. Assess the peripheral pulse rate, rhythm, and volume. Evaluate skin color and temperature. Auscultate the lung field of frequent intervals for sign of ventricular failure, crackles in lung bases. Assess the bowel mobility. Mesenteric artery thrombosis is an potential fatal complications. Observe urine output and check the edema. An early sign of cardiogenic shock is hypertension with oliguria. Examine IV lines and site frequently. Nursing diagnosis. Ineffective cardiac tissue perfusion related to reduced coronary blood flow, risk for imbalanced fluid volume, risk for ineffective peripheral tissue perfusion related to decreased cardiac from left ventricular dysfunction, death anxiety, deficient knowledge about past ACS self-care. Nursing interventions include relieving pain, other signs symptoms of ischemia, administer oxygen in tandem with medication therapy to assist with relief of symptoms, assess vitals frequently. Monitor fluid volume status to prevent overloading the heart and lungs. Encourage patient to breathe deeply and change position often to prevent the pooling of fluid in lung vases. Keep patient on bed or chair rest to reduce myocardial oxygen consumption. Develop a trusting and caring relationship with patient. Provide information to the patient and family in an honest and supportive manner. Monitor closely the cardinal signs and symptoms that signal onset of complications. Thank you.